Okay, so it's important when we're considering rehabilitation that we start to understand the biomechanical principles of stretching. So this really is, it's very easy to implement, whether if maybe you're a yoga or Pilates teacher, but if you are um, providing rehab for your patient or client, then please do bear this in mind. This might be revision for you. I would imagine in your undergrad or your personal training or whatever certification you've done, you would have covered some of this, but it's usually very misunderstood. So I think it's important we do go over it. So joint stability is affected by a few different things, right? So before we kind of go into this, what we want to do is we want to develop that understanding, as we said, of that biomechanical principles that can aid the awareness of the body in action during motion, during physical activity, as our biomechanics of the body is under that conscious control. And this is really where conscious control, right? We are being aware of it. And this is where things like Pilates really, really do come into their own. So movement within yoga or Pilates is controlled through a group or muscle and joint action, which is synchronized with the breath. And that synchronization with the breath really is key. So when you're developing anything for your clients, it's getting them to really tune into the breath and calm their whole nervous system, calm everything down. And each joint is moved by a different individual and group of muscles depending on the movement that's produced. And as a result, the practice of one muscle contracts as the other muscle relaxes and lengthens. So if you imagine, say for example, something as simple as for you to bend your elbow, so to flex your elbow, your bicep muscle contracts and shortens, but your tricep muscle has to relax to facilitate that movement. If it didn't, then there would be no motion. So just getting your head around that, making sure you understand how muscles and joints are working together. And joint stability and mobility is the result of opposing forces. Okay, that's what we're talking about there. Therefore, joint stability can be affected by muscle strength and range of motion within the opposing muscles. Think about that. As I said, bicep muscle contracts, but to allow that contraction and that motion of allowing that elbow joint to get into flexion, the tricep muscle has to lengthen. So consider the movement within the spinal column and the knee joints are examples of how the knee joint can be hyperextended. The shape of the bones forming the joint can contribute to the movement available, and the strength of one joint capsule and ligament structures that surround the joint are responsible for aiding the joint shape and movement. So if you get lax or weak ligaments, it might permit an increased range of motion, such as hyperextension of the knee or the elbow. So joints and limitations. Bones that form stable joints, such as the sacroiliac joint that are held together by a really thick ligament, don't allow a lot of movement. However, ligaments around the shoulder are much thinner and they'll allow a larger amount of motion. We want that. We don't want to be restricted in motion around our shoulders. We want to have that freely movable joint. And muscular structures around different joints affect the movement and function as they are acting to stabilize the actual joint and produce muscle function. So even if you think about the shoulder joint and how the rotator cuff group of muscles really are important for stabilizing that joint. And muscles will restrict movement, whereas relaxed or lengthened muscles will permit an increased range of motion. So bear that in mind when you're considering and what you're doing when you're doing your partial assessments. Over time, any kind of yoga or Pilates practice, you will help your patients, you will lengthen the muscle structures that need to be lengthened and increase the range of motion available at that joint. But also you want to be making sure you're strengthening the ones that need it. With these points in mind, limitations and the ability to perform specific poses, so yoga and Pilates, can result from any factors that determine joint mobility and stability, including muscle, contractile state, ligament and joint capsule length, and the tightness and the bone shape. Because remember, we're all made differently, so you need to consider to yourself, is there a structural deformity there? So meaning the bone will not facilitate that motion. Has there been surgery? Is there a systemic thing going on? So don't just think, oh, I'll just try and make that person move that particular way because that is that type of joint and it should do this amount of motion. we're all individuals, we all have different ailments and things going on, so just bear that in mind. Many people, as they get older, for example, I'm a podiatrist, many of you will know, and they lose the range of motion at the hallux, at the first metatarsal phalangeal joint. And it's an extremely important joint for overall biomechanics, not to mention a whole multitude of other things. That's, again, to detail of that in my gait course. But there is a point where, yes, we want to improve that mobility if we can, as long as it is painless. But there is a point where it's time to let that joint fuse. It's time to not facilitate motion in that. So you need to keep that in mind. Motion generally is always good, but not in all circumstances, because you could leave that patient in a lot of pain. So you need to consider that. If they got knee osteoarthritis, have they got hip osteoarthritis, have they got lower back degeneration? So bear all that in mind, because if you do have a structural deformity there, something that is not going to move, it isn't a structure that is going to change, then you have to adapt. Okay, so it's not just one size fits all. Not that I think that would be the case, but just to state the obvious, hopefully.